The views and opinions in this program are not those of CISA 7 or Spectrum.
I'd like to call the work session to order. We'll start by taking roll call. Beth, if you could help us with that.
Good evening. Becker?
Here.
McCoy?
Here.
Shelton?
Here.
Sitnikau?
Here.
Smith?
Here.
Vanden, Heuvel?
Here.
Warren?
Here.
All right, all 7 board members are present. We're also joined by Superintendent Steve Murley, along with members of his cabinet. We're also joined by 2 members of the Intercity Student Council, Noah Becker and Paige Dessart. Thank you for joining us tonight. We'll start off, first thing on our agenda is the open forum. We have 1 person who is wishing to speak to us by phone, and so Josh will take care of calling that individual, and then we have a few people who want statements that are read, and we'll take care of that. Just as a reminder, if you're interested in addressing the board, you can either submit your comments written online and someone can read them for you, or we will call you during a live board meeting. When we do make those calls, it shows up as an out-of-state number as a result of the platform that we're using. So we'll make that phone call now and get ready for our first public comment. Mr. Meyer, can you hear me?
I can. Can you hear me?
Yep. This is Eric Vanden Heuvel with the Green Bay School Board. Appreciate you taking the time. If you would start by introducing yourself and giving us your address, and then you have 5 minutes to address the board.
Great. Thank you. My name is Ryan Meyer. I live at 3267 Hickory Ridge Lane. I have 2 children in the school district. The one that I'm calling about tonight is my oldest. She's a sophomore at Green Bay Preble. And what I'm going to describe to you only appears to be impacting her. It's not impacting my younger daughter, who is in 7th grade at Red Smith. My older daughter, the one I'm calling about, through her first year of high school, she's a straight A student. She's got a 4.0 grade point right now, and she takes her studies very seriously and spends a lot of time on her homework every night. And she's very upset right now because it appears that there's been a policy change because her homework is no longer considered part of her grade for any of her classes. And so she spends all this time on her homework every night. And while it's good practice and learning the material, it's not adding in the buffer that it used to add in. All that's considered for her grades are her quizzes and her exams. And in a year where these kids have a lot being placed on them right now anyways, with having to do school virtually, I don't know why we would have a policy change like that this year as well. So I wanted to find out what the thought process was. And also, some people are just not naturally good test takers. So to place undue pressure on performing on the exams, again, especially in a year where these kids are having to absorb as much as they're having to absorb anyhow with virtual, I just don't agree with the policy, even under normal circumstances. And certainly I don't agree with the policy in a year like this. And so I'm just curious what the thought process is. And if there's any recourse here, or just say, what do you need me to say?
She gets glitches on tests and she's.
Oh, and she gets glitches on her tests when she's taking her exams because of the technology issues. And so again, if you're placing undue pressure on the tests because homework is no longer considered part of their grade, we're just having a hard time understanding that. So I guess that's all I have to say, and I'm happy to answer any questions if there's any follow-up.
Sure. Ryan, we're not, because we weren't posted for this, we can't discuss or address your concern right now, but somebody will definitely follow up with you to look more into this issue and to talk about the issue that your daughter's having.
Eric?
Thanks so much.
Eric?
Yep. Before you hang up, Ryan, board member has a clarifying question.
So we can ask clarifying questions, correct?
Yeah.
Okay. Thanks, Ryan, for speaking to us tonight. I'm wondering if you've spoken to your building principal at all.
I've talked to the assistant vice principal for children whose last names are M through Z, which I qualify for that. And what he described is that he told me his perspective on it, but he said I may want to see if I can get on the agenda for a board meeting, which is what led to this tonight. But what he described to me at the time is that it's always been the policy at the high school level, but it's only been loosely enforced previously. And this year, they made the decision to more strongly enforce it. And he said the thought process, as far as he knew, was not everyone is as diligent with their homework as my child is. And a lot of kids are struggling with their homework as they're learning the concepts. And they didn't want to penalize those children as they were working through their homework to learn the concepts. And what I shared back with him, if that is indeed the reason, I said, that feels an awful lot like participation trophies, if you will, where we cater to the lowest denominator. And I don't know if that's the right answer here. And again, good students and bad students alike, some people are just naturally better test takers than others. And if we place all of the burden on the test, I struggle with that. So that was that conversation. Yes, thanks for asking.
Okay, thank you.
Okay, thank you.
All right, thanks for taking the time to call in, Ryan. Again, somebody will definitely follow up with you and your family very shortly.
I appreciate it. Thanks a lot.
Yep. Have a good night.
Bye-bye.
All right. I believe we have 3 people who are registered or have comments that they'd like read, and believe Melissa has a reader for us for those comments.
Yes, I'm here. First comment from Jennifer Hansen, 2050 Sandalwood Court in Green Bay. The subject is gating criteria for hybrid model. I would like clarification on why students and families of GBAPS are being held to a higher standard for COVID status in Brown County than other districts. West De Pere is FT in person, De Pere, Ashwaubenon, and Howard Suamico, and NDA are all hybrid. They have all taken on the challenge of screening, monitoring, quarantining, and fluid transition from hybrid to online as needed. GBAPS has now had an additional 4 weeks to gain direction, yet we remain fully online despite the survey results collected twice prior to the start of the school year, indicating families desiring at least partial in-person education. I understand the board is awaiting county-specific criteria, but as was made very clear at last week's meeting, this will provide data only, not guidance. Yes, this is a large district. However, your students are not entitled to inferior opportunity because of the lack of direction. High school and middle school students also fall into the recommendation by the American Academy of Pediatrics for in-person instruction. It is concerning when again last week there was mention of elementary students returning earlier than middle and high school students. Social and emotional needs are as great as educational needs as they are not being met. 4 days per week of limited instruction time is not sufficient. School board members, you are elected to represent us, yet you are ignoring our voice. The minimal communication from a new superintendent is also concerning. Overall, it strongly appears that this district, despite its abundance of administrators, is incapable of putting into practice what other districts are currently managing. I do not take COVID-19 lightly, but we all recognize it will be with us for an extended time, and we need to be progressive in balancing this with the education, social, and mental health needs of the district's children and families. If transportation cannot be provided as prior, despite the fact that we are paying out of the contract, that should not disallow in-person education options. The primary focus of a school system should be teaching, not meals or transportation. Those are vital as well, but education must remain in the forefront. It has been abundantly clear as well that a fully online option will remain available to families so choosing. They will not be forced into a situation where they are uncomfortable with. The children and families of GBAPS do not deserve any less than those of the districts previously mentioned. This is less than ideal situation, but clearly it is manageable. Please initiate a transition into a hybrid option for K-12 as soon as possible. Please listen to the needs of your family. Next statement is from Rick Conop, 2799 Alloway Avenue, Green Bay. The subject is so far. I am sure that you are getting many comments regarding the start of school year from parents. My guess is that you are receiving many negative comments as this squeaky wheel tends to get the grease. I'm very happy with the virtual start. My son, a senior at Preble, has embraced this new way of learning. After a few initial glitches, the technology is working. His teachers are doing a great job in both the actual teaching and with their availability for help outside of class time. It needs to be pointed out that as other districts surrounding Green Bay are finding out that the virus is still an issue and that by starting virtually, Green Bay is not having to change from in-person to virtual with limited notice. I would guess that having these constant changes would be more difficult for parents to adjust to. With the excellent decision that you made, we as parents knew what to plan for. Please stay the course and hold off on in-class teaching until it is safe for students and teachers. Thank you. The next comment is from Nicole Rasner, 3023 Crusade Lane in Green Bay. The comment is, the subject is staff concern being on site. Hello, I would like to know the reasoning behind having some schools remain open for in-person teaching when the caseload for COVID-19 is worse now than it was back when schools closed in spring. Being in a classroom where the children we are around are not required to mask and are not in constant home-like situations is concerning. Not knowing and requiring no health check forms to enter the school is a major concern for me. Eric, I was told I was supposed to read the fourth one as well.
Sorry, I think we can skip the fourth one. They had asked that their comments be redacted.
Okay, then we're done.
All right, thank you.
Okay.
All right, so that wraps up open forum. We'll move on to the discussion items. One item tonight is obviously to discuss the gating criteria. As a reminder, and I mentioned this last week, we're not taking a vote or making a motion on transitioning from our models, but rather setting gating criteria that will hopefully help direct us on when we can transition between our models. We've seen other districts in Northeast Wisconsin switching to an all virtual model recently, and certainly that's where we have been since the start of the year. But we do want to try to have some guidance on when we can get back to a hybrid model. So there's a couple of decisions that Steve would like some guidance on, some direction from the board. So I'll hand it over to Steve, and then we'll go back and facilitate a discussion and hopefully try to provide some direction. So Steve, do you have any comments?
I do. Thank you, Eric. I appreciate the opportunity to bring you up to speed on where things stand today and hopefully get some input from you that will help us frame motion or motions for you to consider at the next board meeting. I know we have been clamoring for some time for more guidance from either the federal, the state, or the local level. And as I shared with you via email late last week, we now have a framework that's been provided to us by the Centers for Disease Control at the federal level. That's entitled Indicators for Dynamic School Decision Making, and you'll find that attached to the agenda today. They've given us both a large version of it, which is in the indicators threshold table, and then that's embedded in the school reopening indicators to inform decision-making document. That provides 5 different levels for us to consider as a method for developing gating criteria to bring our students from the off-site to the blended and then to the on-site model eventually. So take a moment and go through that. Before we do that, the second decision that we see in front of us tonight after we determine whether it's appropriate to use our CDC guidelines to frame our gating criteria is a data source to which apply those gating criteria. And we have 2 choices in front of us right now. We have DHS data, Wisconsin Department of Human Services data, or Health Services data, sorry, which is what we have been using so far. And also Brown County Public Health also has a new dashboard out. And so what we're hoping to gather from you tonight is hopefully some direction. We're recommending that you consider the CDC gating criteria, and I'll walk through that with you. And then we're looking for your preference for data source, either Wisconsin DHS or Brown County Public Health. When we know both of those things and we get additional input from you tonight, we will use that to draft, again, motion or motions for consideration on October 12th. Sorry, I get the month right there. On October 12th for consideration for the board for approval. So before I jump into the CDC component of it, does anyone have any questions or anything I need to address before I get started with that? Okay, thanks. So if you take a look at the CDC information, again, there are 2 specific documents that I'll reference just from a visual for those in the audience as you're looking them up. The one is this multicolored chart. It is embedded, perhaps a little bit harder to read, in the second document. Again, if you want to look at it in the large print version, if you will, it's in the document entitled CDC Indicators Threshold Table. If you read further into this document, you'll see that they have developed for us 5 different levels. And they are entitled Transmission of Risk, or Transmission in Schools, Risk of Transmission in Schools levels. And they flow from left to right, lowest, lower, moderate, higher, and highest. In those 5 categories, they have indicated that in the moderate, higher, and highest, school districts should consider having either off-site or a blended model of instruction. So as we read through this and looked at it, by inference then, the presumption is that when you are in the lower or the lowest categories, and those that are the 2 in green on here, that when you're in those categories, that we would have on-site instruction for students. I draw that to your attention because if you recall, the current gating criteria that we have in place says that we would consider a move from off-site to blended when we reach 5%. And I would draw your attention to 2 of the key metrics in the core indicators section on here. The first one is the burden rate, and the second one is the percent positivity rate. The CDC is actually recommending that when you hit that 5% level, that is when you would consider being on-site for instruction. So that may be a bit more aggressive than what we've been looking at in the past. The burden rate shows that at less than 20, we would consider being on-site in instruction. The other thing that's important to consider is they have 5 key mitigation strategies for schools. And several of those we have direct control over. One of those we have no control over, but we certainly have the ability to collaborate. The consistent and correct use of masks is one of those 5 factors. Social distancing to the largest extent possible, and you'll remember that the CDC has a recommendation of 6 feet or more. Hand hygiene and respiratory etiquette, and that's hand washing, covering your mouth when you sneeze, et cetera, et cetera. Cleaning and disinfection, and so that's the physical spaces that the children are in. And then the last one is the one that we don't have control over, but we have had conversations with the local public health department, and that's contact tracing in collaboration with the local health department. So their recommendation is that you be able to implement all 5 of those strategies correctly and consistently to consider that transition. So as we look at this chart, we would be suggesting that on-site education take place at that lower and lowest risk of transmission, and the appropriate gating criteria then that would go with that would be less than 20 for our burden rate, less than 5% for our positivity rate, and the ability to meet all 5 of those metrics. I will just share with you that because I know there have been questions about it, the second bullet, which says social distancing to the largest extent possible, is their way of saying that to the extent you can, you want to maintain that physical distance space of 6 feet between people in the building, but they recognize that that is not a hard and fast requirement, that you do it to the greatest extent possible, but you may not be able to do it all the time in every situation. So again, then that leaves us with considering the moderate, the higher, and the highest categories. By inference, if we're looking at lower and lowest for the on-site instruction, we can consider looking at higher and highest for the off-site model. A couple things there that are important for you to consider. Remember, we talked about our current gating percentage being 5% for a transition. You'll see that this is going to be a little bit more aggressive because the higher risk of transmission is 8% or greater, and the highest is 10% or greater. And we had talked about not considering a transition back to blended until we reached 5%. So this is going to allow that number to be a little bit higher at 8%. In the burden category, they're looking at 50 or greater in the higher category and 200 or greater in the highest category. So this is a little more conservative in the burden rate. And again, it's going to be a little bit more aggressive in the percentage rate. They do recommend that you be able to implement 1 to 2 of those strategies correctly and consistently. And certainly because we have control over things like the use of masks, hand hygiene, cleaning, and disinfecting, we're very confident that we can meet 3 of those with 100% consistency. And then the physical distancing one, which is the 4th one that we have control over, we feel that we can adhere to that to the greatest extent possible as they suggest. So then that would leave the last category for us would be what does it look like for a blended model? And that would fall in the center column there, which is the moderate risk of transmission. That would have your percent positivity at 5 to 8%, your burden rate between 20 and 50, and an ability to implement 3 to 4 of those mitigation strategies. So that is the CDC guidelines in a nutshell. I guess, like I said, we've been clamoring for some type of guidance from an appropriate level of government. I'm pleased to see that the CDC has put this out. While they don't line up 100% with the conversations that we've been having at the board table, they are very, very close to it. My hope would be that this is the type of framework that can be adopted not just by our school district, but perhaps considered by other education entities, whether they're K-12 or higher ed, and provide an appropriate framework that comes with the endorsement of the CDC with it. So that I'll stop and ask what kinds of questions I might be able to answer for you about their model and their metrics.
Go ahead, Laura.
Steve, have you had a chance to discuss this with any of the leadership groups? And I guess maybe I should preface that by asking if those groups are still going to be meeting now. Since people are working all day long, it might be hard, but I mean, have they had a chance to chew on that?
We're actually meeting tomorrow, and so this is one of the issues that we'll be discussing tomorrow when we meet, and this will be all of the superintendents in Brown County.
Go ahead, Rhonda.
Steve, can you speak to, you had mentioned that you said the information that you received from the CDC that we received doesn't necessarily line up 100% with the conversations we've had at the board table. Can you speak to what the differences are or what you see the differences are?
Probably the one that may be of most concern to our community, our staff and students, is we've been speaking regularly about our 5% threshold, that we would not consider returning students into the classroom until we reached 5% positivity or less in the testing ratio. The CDC model shows 5% being at the low end of the moderate category, which is the one in the middle. If you read their conversation, they're talking about that moderate category, I think clearly from their conversation, being a period of time when you would be considering a blended learning model. So if that moderate category is 5 to 8%, that number would be higher than we've been talking about as a board when we look at returning students from an offsite to a blended model. So I believe this, I would say that the CDC guidelines are a little bit more aggressive when you look at the percent positivity.
Can I ask you a question about that, a follow-up? So we had talked about this quite a bit. We had brought it up. It was the big reason why we looked into gating criteria in the first place. It's been mentioned quite a bit from the community as well. I'm wondering what your opinion is because of the testing capacity, whether it's 5% or 8%. Do you have any concern about the testing capacity when it comes to trying to meet those numbers?
I think if this was,
I have that concern because again, who's being tested, right? How many tests are we receiving as a community? I'm not hearing a lot of conversation from the CDC about that. And if that's factored in, I'm just wondering what you think about that.
I think if this was a sole metric model, which is I think a lot of the conversation that we've had at the board table was that the 5% as a standalone is a bit of a challenge because it may float up or down based on who's being tested and how many tests are available. And I know that's why in our last couple of meetings, we focus more on the burden rate than we have the percent positivity. The thing that I do like about this model is it's a multi-metric model, so it asks us to consider that positivity rate, but it does also look at the burden rate. My presumption, and of course I don't know exactly what the process they used to develop this is, but I think they took exactly the concerns that you just shared, Rhonda, into consideration, and they are more aggressive in the percentage. And I think that is a recognition that if there aren't enough tests available, or if they're only testing people that appear to be sicker, that they have allowed that percentage to float higher than they originally recommended. If you remember back in when New York was having such difficulties, the CDC's initial recommendation was 3%, and then they raised it to 5%. I would argue now that it looks like they've raised it to almost 8%. And so I think that the CDC recognizes the exact challenges that you just identified. And then by adding the burden rate to it, that shows us our new cases per 100,000. And so I think that regardless of where the percentage testing is at, that allows us to see what the actual impact is in the community in terms of the number of people that are getting ill. And so I think that gives us a balance.
Can you address the burden rate though? You had said that you believe it's more conservative. The CDC
Sure.
gives something more conservative versus what was discussed at the board table. How do you see that as being more conservative, and do you find that to be a better metric, and why?
Well, they've got ranges in there. So their burden ranges are less than 5 to 20, 20 to 50, 50 to 200, and then greater than 200. So when we've been originally looking at this and having conversations at the board table, while there hadn't been any decisions by the board, there had been conversations in looking at 100 as a burden rate. That obviously falls in between in the highest category, which has a fairly large range of 50 to 200. And then the moderate range has a 20 to 50 range. So 50 was also a number that we talked about. We've run some of the modeling on 50, but obviously this is going to be a little bit more conservative as we look at moving from off-site to blended. We were looking at 100. The low end of this threshold is 50. So it's a little bit more conservative on the burden rate, but it is definitely much more aggressive on the percent positivity rate.
Thank you.
Mm-hmm.
Kristina and then Andrew.
Steve, a question for you about that middle yellow column. As you're talking about hybrid, that being that option, if we look at that sort of in the color coded, can you speak about if we decided to do that, families would still be able to choose all virtual, correct? That would be an opt-in. Can you just clarify that for our viewers?
Yes, thank you. That we should always clarify that. I appreciate that, Kristina. Yes, one of the things that we have said is that we recognize that some parents may have children that are unable, or there may be some families that are just reluctant and not ready to return to school. So we have the ability through the Department of Public Instruction to continue to offer an online program for students, literally right through to the end of the school year. And then we've talked about developing on-ramps for them, so that if we do indeed return kids to school, the children and their families would have the opportunity at specific points in time, certainly at the semester, perhaps at quarters, where they could come back into class.
Thank you. Yeah, and I just have a quick comment too, Eric, real quick, and then I'll send it over to Andrew. And it's just about who's being tested, and I'm sure most of you saw this, but just important to note that Voces de la Frontera has been working with the Brown County Health Department and the county health supervisors, with the mayor's office and our local health departments, or hospital systems, to look at access, especially in our Latino, immigrant, and undocumented communities around testing. So there's, definitely a conversation, because I think to Rhonda's point, it's important to think about who's being tested. It's been good to see our community have some of those questions. We're not there yet, but I think it's on our radar, and it will help to inform our decision at the table. Thank you.
And maybe just one other note too. I know there was a national press release that came out today that talked about a significant number of rapid response tests that are going to be shipped here in the very near future. And I believe the hope with that is that we'll be able to get much more rapid turnaround on those test rates too, and really eliminate the delay that exists in the system right now. So I don't remember the number off the top of my head, but it was something like 150 million rapid response tests that they're planning to ship, if not already shipping soon.
Andrew?
Okay, so I have 2 points to start out, and one is one's a bit technical with the math, but a serious issue about how the positivity rate is calculated. But before we get to that, I want to translate the motion that I made a few weeks ago that was passed first reading and failed second reading as to what that meant roughly under these numbers, because the 100, the 80, the 60, and the 40 proposed were for, you would have to meet them 2 weeks in a row. Okay, so for simplicity, you would want to double those. So the over 200 new cases per 100,000 people total, which was in my motion, that would have in fact matched exactly the CDC's highest. And so that motion and the CDC would have, well, I can't even say that the CDC would be in agreement, because they do say several times in there you could use alternate models, and I understand they're directed. They're an appointed body, and they've been, I think, directed to not suggest schools close. Okay, so, but our decision is too important for it to be inference based, in my opinion. So what we would have had under that motion, roughly would have been over 200 cases. Everything would have been offline. And then from 160 to 200, elementary could come back hybrid. And from 120 to 160, secondary could come back hybrid. And then below 80 cases, so all of those divisions are in the orange here. In addition, if you think the lowest risk under 5 per 100,000, I already said I don't know that we will ever see under 10 per 100,000, because that's total, it's not average. And you can look at the county dashboard is a daily average, but I believe the CDC is talking total here. So this 14-day number, we're never going to see 5. We will probably stop testing for coronavirus because the pandemic will be declared over before we would even reach 5 per 100,000 in 14 days. Maybe we'll hit 20 after there's a vaccine. And I'm not interested in setting an unattainable metric. And I believe that the public needs to know, when are we going to blend for elementary? When are we going to blend for high school? And then when are we going to bring, that's the stage I missed. Elementary could be full while high school was still, secondary was still blended. And then, so this is a vastly more restrictive metric than if we're actually talking about not having a full-on site till we reach 20 or till we reach 5%. It's certainly one that is so restrictive that I couldn't vote for it. It becomes as restrictive. It's getting right up there with the most restrictive jurisdictions in the country. I think I worked to find a balanced metric, and the 200, 160, 120, and 80 falls very close to the midpoint of what permissive and restrictive jurisdictions are doing. And this puts such a large amount of days into orange that we wouldn't be opening. So this is, yeah. So I also have, now there's a lot of reasons I don't like the positivity percentage, and more critically though, I don't believe it's possible for us to really get the correct positivity percentage, which I'll explain. I appreciate that it was pointed out in a communication from the public that the state numbers are subtracting people who have been tested twice, which becomes less accurate over time. Now, the county doesn't so the county does look at, they have a column called daily tests received and daily positive. So you can get closer to an accurate percentage number there. However, they exclude the Oneida Nation, and the Oneida Nation overlaps with our district territory. So calculating the positivity percentage off of the state data is going to be really wrong. It's going to look much worse than it is because it doesn't include people who've been tested again. Doing it off the county data is not going to be as wrong, but it's still going to be a little bit wrong because Oneida is missing. And again, since they're, if the county was missing only territory that did not overlap our district, I might be less worried about it. Kristina?
Sorry, I couldn't get myself on mute. Well, we're going to talk more about that though when we talk about the next issue though, right? Because I hear what you're saying, but I just want to make sure we focus on the CDC one now. Because we haven't talked about the other metric and the limitations of the data, so I don't want people to get confused, Andrew.
Right. Okay, well, sure, but the problem is we can get the, like we can use either data source to get, we can use the state to get the exact case burden, or we could use the county to get a close approximation of the case burden, but we can't use the state to get the positivity percentage because they're excluding people who were tested twice. So the state's version is inflated. But so if we can't use the state's version for positivity percentage because it's wrong, because it doesn't include people who have been tested more than once, we would have to turn to the county data if we wanted to use the positivity percentage at all. But I don't think we should do that either because it too will be wrong because it excludes part of our district's territory. So I don't think, even if we wanted to, and although I'm not a fan of it, even if I wanted to be a fan of it, I don't think we can get a correct percentage, and that's a problem. Now, you could say the county's percentage is close enough if we use the county for a positivity percentage. However, that's only correct if you manually calculate it because it appears that what they report as a 7-day rolling average positivity rate is to actually take each daily data point and average them, because I was looking at it, and this is very important. You can't just take each day's number, add them up, and divide by 7, because, for example, you would get, that would result in an average, a 7-day positivity average of 25% from the week of September 6th through the 12th off the county's data. But that's because one day was a holiday and 78 out of 90 days were positive, and it was counted equally as 162 out of 2314 2 days later. So that's also incorrect. And what that week should have been is something more like 14%, but they reported it as 25 because of how they averaged the numbers. So that's an issue. So I am very concerned that we do not have a way to access a correct positivity percentage from either county data or state data, and therefore I don't think we should use it because we can't get it.
Go ahead, Kristina.
So then what's your suggestion, Andrew?
I think we should use case burden only. Unless we're going to do the additional legwork to actually ascertain the positivity percentage for the county correctly, if we can even get that.
And you're saying that you believe we can get that data and that's accurate?
Sure, because they even have a column that the positives, the county matches the positives with the state. The total new positives matches, or I would probably use the states because Oneida Nation isn't included, but yeah, so we can't use something that is not correct.
Okay, so just to be clear for everyone that's watching, and I want to make sure I'm clear, what you're saying in the CDC is that of the top 2 core indicators, you're saying that you don't believe that the second line item, the positive during the last 14 days, you don't believe that we can get good data on that one, so you're advocating for just the top one, the burden rate.
That's the most pressing reason right now, yes. But I also, from the beginning,
Okay.
I've said that the number of people in the community who have COVID-19 is the really important thing, and the fluctuations based on how many test kits are being shipped to this part of the country instead of another part of the country greatly drives that positivity metric greatly. And
so it's a combined factor of the data, in your opinion, I'm just making sure I'm understanding, the data being valid and usable, and the limitations of testing.
Right. And it doesn't, and this isn't just me saying let's not use positivity because Becker is more into opening schools than other people. It's about getting it right. And I am also not interested in, let's just say we had a day where, 1,000 people had COVID, but we miraculously were able to test 100,000 people in the same day. That 1% positivity doesn't make me feel good. It's still very bad that 1,000 people in Brown County would have had COVID on the same day. So I don't see what we're getting out of having the positivity percentage, except as maybe a secondary warning or a secondary indicator that maybe you should take the numbers with a grain of salt because the percentage seems high, or very early in the epidemic when you don't have enough tests to go around. Yes, but I really think the important thing is how many people have it, because the second thing is driven more by the number of negative tests than the number of positive tests.
Go ahead, Rhonda.
I have a lot of the same concerns that Andrew has. I think about this pretty much in the same context. And we've been hearing from a lot of people about this as well. And I guess what I'm interested in knowing is if there are people on the board that are comfortable with that calculation, I'd like to know why and how.
With what calculation, Rhonda? Can you be more
Well, okay, yep. The concerns that Andrew has, and I've mentioned almost at every meeting about the percent positives with the testing capacity, the fact that you can't count someone, more than once. It just seems it's just ambiguous for me, and I'm not comfortable with it either, especially if it's going to be driving our decision making. I just haven't heard any compelling reason why this calculation of percent positive is the way to move forward. I'm not saying the burden rate isn't. I feel much more comfortable with that as well. But the percent positive, I've not heard anything that makes sense. And I'm just wondering if there are people on the board that feel that it does. I'd like to know, maybe you could help me understand and share why. Does that make sense?
Go ahead, Brenda.
So I agree with that. To me, the case burden makes more sense to rely on as our first gating criteria. I think in general, what we've seen is that the positivity rate has tracked along. I mean, if our numbers go up, the positivity rate's going up. And it is it does seem less reliable just because of the fact that if we have a lot of tests, then we test a lot. If we don't, and I think that number really is there. As I understand the positivity rate, that number is there to indicate your ability to test enough to be able to manage and try to control the infection rate. And it's not necessarily an indication of cases. It just tells you, if you have a positivity rate of 1%, it means you're testing a lot, you're finding those cases, you're quarantining, you're doing contact tracing, all of those kinds of things. So I think I would put less faith in the positivity rate. I do want to ask a question though, because I want to make sure we're talking about apples to apples when we talk about the case burden rate. Because we have, and Andrew alluded to this, but I just want to make sure that we're absolutely clear in the numbers that we're talking about. Because the CDC says the number of new cases per 100,000 persons within the last 14 days. So I too, like Andrew, interpret that to mean you've only had, well, I'll just pick the 50. You've only had 50 new cases per 100,000 people total over 14 days. And then the numbers that we're looking at on the one that has both the DHS and Brown County rolling averages. So they have a 14, well, I'll just use Brown County's. Brown County 14-day rolling average positive case rate is 907 right now. So is that number the number we should be comparing to 50? Or is that, I mean, it seems like that's the number, unless I'm completely, it seems like that's the number that we are comparing to the CDC's number as of yesterday's, as of the 27th of September. So anyway, I don't have an answer. I just want to make sure that it's very clear the numbers that we're referring to, and that it's apples to apples from chart to chart.
Yeah, I think it's about 9. I think it's, if you look at the 14-day new cases per 100,000 people, if we look at ending the 27th, I have both spreadsheets. If you use the state data, and again, these are going to be close for the positive totals. From the 14th to the 27th, the state says that Brown County had 2,406 cases in 14 days. Brown County's
Andrew,
total.
Yeah, is that on one of our charts, or are you just doing the math there?
I was doing the math there. So you would divide then by the county population and multiply by 100, and yeah, the answer would be, so it is close to 1%, or close to 1,000 new cases per 100,000 persons total in the last 14 days. So yes, we're at 200 being the cutoff. Yes, would have. So yeah, we are five times higher that cutoff to go off site, unfortunately, and that particular cut point would have been the same under the motion I proposed. That also matches the CDC's red category. The difference being that all of the other motions fell into, all the other parts of the motion fell into different parts of orange. And again, we are not going to get to, we will probably not get to the light green, and like I said, I really don't think we will ever get to the dark green, because we would have to get to, that would be less than one person per day in Brown County, in all of Brown County, getting it. And even in places that have done a great job getting COVID under control, I don't think we're seeing 5 total per 100,000 total over 2 weeks.
Kristina and then Noah.
I'm wondering what the rest of the board thinks about this. It sounds like a few of us, you know, I don't know how everyone feels about the burden rate being the top metric over the positivity rate. I'm wondering what Laura, Dawn think. Eric, I'm wondering what you think. I'm wondering, Steve, what you think, because again, tonight we're not going to nail down all of the numbers necessarily, but we're trying to have guidance for Steve and his team so that we can do more work and come back in a few weeks to actually vote on this. So I'll open that up to the rest of my fellow board members.
Why don't we get Noah's comment, and then we'll go to Dawn and Laura and see where you guys are at.
Okay, thank you, Mr. President. So I guess I have a couple questions. I don't know really what I'm supposed to ask them. But yeah, I guess so I get the CDC put this out. It's not like this is district created, so I'm not gonna like make you vigorously defend this metric. I guess, is there something that administration saw in this that helped them feel a little bit more confident than maybe what they were seeing in some of the other metrics proposed, or because you know there are still, I've seen a slightly stricter ones. I've seen much more lax ones. Exact. So I guess what does administration see in this that they like?
Well, no, if I could just answer that quickly. I mean, the administration was acting on the directive from the board, and what our desire was to have something that was vetted by some authority on public health. So it wasn't the administration picking this. It was us saying we want something from either Brown County Public Health or DHS or the CDC, or at some level we want some guidance, and this is what we got. Okay.
No, thank you. That makes sense. I'm kind of lost here. I'm trying to, okay. Thank you. Appreciate that answer. One more thing. I know you guys want to talk about the actual numbers here, and I don't know, I'm probably less qualified than a lot of other people around this table, but yeah, I guess I actually do see the value of having a positivity piece, but not like this. I guess I think I do see value in when the board comes back to look at what future steps would be, just to make sure that it's reasonable, right? Like was already said, like the numbers you're seeing for burden are real, essentially. It's not like a fluke, because that's not the intent of those numbers. So that makes sense to me. I guess I just don't, the layout here, I guess I'm kind of confused. I don't know, are there any hard triggers in here or not? Because I really can't tell. Like it's got colors, which is nice, but all I know is the risk of transmission in schools, which I don't know how useful that is, because I know that some will spread anyway in schools. So I guess, like, is there a way I can correlate in my head between this chart and when school would start to change into a different model?
That's what we're trying to figure out. That's okay. What we're talking about.
Thank you. I'll let you guys go first. I'll rant later. Thank you, Mr. President.
Yeah, go Dawn, go ahead.
I agree with Brenda. I mean, as I've been watching burden and positivity, they really seem to be line in line. I'm not a doctor, and I certainly don't question the I don't want to say I don't question the CDC numbers, because right now I'm questioning everything. If everybody on the board says they think burden is the way to go, that's not where positivity, I guess I could say I can take it or leave it. I do agree that burden is the most important thing. I also think from what we've seen, it's pretty consistent. If our positivity numbers are high, our burden numbers are high, our positivity numbers are high. So I don't see, from my standpoint, I don't have a huge issue with not going with the CDC, if that's what the administration would recommend. But if the rest of the board really thinks positivity is an issue, I don't have a problem with that.
Laura and then Brenda.
I would concur with that. I would rather go with the burden rate as the first indicator, and I don't really have any problem with the CDC core indicators that Steve shared with us, and I'm comfortable with that.
Go ahead, Brenda.
Another concern I have with using the positivity rate is that when you look at the DHS and Brown County's positivity rates, they're almost half. And so if the CDC is recommending a positivity rate, what recommendations have they made to calculate that? Because obviously the state and the Brown County are doing something, they're calculating that positivity rate very differently. And I know it has to do with how they're scrubbing the data and making sure that it's accurate and things like that. But if the CDC positivity rate is based on the metrics that the state is using, and we use Brown County's, then we're not matching that. And so that's just another reason why I just think it's more important that we focus on the case burden rate, because it seems like there's less, there's some difference between the state and the county, but less than with the positivity rate. And then sorry, I keep coming back to this, but this chart that we have, Steve, I don't know what it's called because I have it in paper. The one that just has 4 columns. It has the case burden rates for DHS and Brown County for positivity, and then the case burden rate, the other 2 columns. So and again, I'm just wondering if we can have the case burdens be calculated so that they match how the case burdens in the CDC chart are calculated. Because as Andrew said, I think you have to use the population of Brown. I'm not sure if this number matches that. I don't think it does. Because Andrew, what did you say you calculated it? Instead of 907, it was what? You're on mute.
I'd have to, what are we, yeah, I guess it depends what I'll go on the state website and I'll look. It depends. I don't have the Brown County. Is it 259.7? Is that, I think that's what we're using for the county population. At least that's what the state is.
259,786.
Yeah.
Okay. So, all right. So if we're looking at 259,786, then and you use the state data again. This just to keep it consistent because the county data ending today isn't available. It goes through yesterday. So if we add up the state's positives from the state's reported positives for Brown County from September 14th through the 27th, we get 2,406 divided by 259,786 times 100,000. So using the state numbers, it would be 926. But we might be splitting hairs a little bit because the state might be using the 2019 census estimate and maybe Brown County isn't, but Brown County does have slightly fewer. Brown County's numbers says 2358, probably because the remainder of the cases were from Oneida Nation. Divided by 978.
On the same day that Andrew just calculated the 926, that date Brown County calculated 908.
Okay, 907. Yep, 907.7. Yep, so 908. So that difference in 18 would be the difference with Oneida Nation, which again I would still prefer the state data for positive cases although the county certainly has a much better handle on actual tests received, and I'm really happy to see that there's a lot more tests being taken, certainly, than I thought when I only had the state data to look at. But yeah, I still think, yeah, case burden, I think case burden is the key metric. So yeah, that would be the difference between 907 and 926. I just did 950 in my head as an approximate.
Yeah, but so my question actually so is that 907 the same number that we would stick in that CDC chart right today?
Well, yeah, except I think we should stick in 926 so we're including Oneida Nation, but yes, it's that same number.
Okay, so
we're way above.
Oh, yeah. We have a long way to go to get to that number. Yeah. Okay, I just want to make sure that that's very clear what numbers we're talking about with our own numbers as we compare to CDC. So,
and we would have a long way to go. We're much above Minnesota, which is a surprisingly permissive state, allowing some hybrid education to start at 500. And Harvard Global Health, which is what I believe lacrosse schools are molded after. Harvard Global Health, their cutoffs would be 350 to start blended and 140 to start in person. So that's translated from per day to per 14 days. So yeah.
Okay. Go ahead, Rhonda, and then I'll go.
Okay. I would like your opinion, at anyone that would like to speak to this. When you look at the CDC table where it talks about lowest risk of transmission in schools, lower risk of transmission in schools, when you're looking at those, the lowest risk is 5, lower risk is 5 to 20. Does anyone believe that even with a vaccine, we would be in that category? That we would actually be there? I just don't believe we would. And if you do, can you explain how you believe that? I just find that hard to believe. And so what that tells me is that even next year we wouldn't be here.
Go ahead, Kristina.
I would say that personally, I don't think anybody on this call can actually answer that question. Nobody knows. I mean, I don't know how anybody could look at this and say with a definitive answer that yes or no. I mean, everything is changing rapidly. Depends on how many kids we have in schools, if we can social distance, if we move and do more outdoor education. There's so many factors that I think we're learning as we're going. Is it possible? Yes. Is it, going to be easy? No. That would be my answer. But I mean, I think we should always be thinking about creative ways we can get back. But I just don't know how anybody can answer that definitively, although it's a great question.
Yeah. But here's what I would say that I believe that we will be asked about, and what people are waiting with bated breath for us to do, right? They're waiting on us to make some sort of gating criteria decision, which I believe that's what we've been meeting about for a while. If we are interested in going with something like this and using this as a template, then we are in fact agreeing to it. And so what that's going to tell our community is that you probably wouldn't get back into a hybrid model until you had 20 to 50 cases per 100,000. Unless I'm reading this wrong, tell me if I am, because it's very possible. But that's concerning to me just because it feels like it would never happen, and it doesn't even feel like it would happen next year. So I'd like to be able to answer just that in itself.
All right, let's go around the horn. Kristina, Laura, Dawn. I'll get a chance here eventually.
Yeah, I'll make this really quick. I would say you're absolutely right. And what I would remind us all is that any time we can come back and change the criteria if it's not working for us. Like this isn't like locked in stone for the next 10 years, right? If we make a decision based on what we know and in a month it's like that's not going to happen or that's impossible, we come back to the table. I know that's not what people want to hear, right? We like definitive answers in our culture, and I think that those definitive answers play a role, but we also have to remember that there has to be a level of fluid and flexibility. But, you know, that's.
Go ahead, Laura.
I agree with Chris. I agree with Kristina that we cannot offer certainty, and we're speculating, and I don't want to give anyone a sense of false security. So, and every other district is dealing with this as well. So, I wish that we would focus on this gating criteria.
Yeah. Okay. Dawn, did you have something else to add?
Yeah, I guess, you know, and I agree with Kristina that I don't know that anybody here can say this. I guess I'm looking at it, and CDC is saying that this is the lowest, you know, low transmission within our schools, and that whether or not that's what we want, that doesn't change the fact that the CDC is saying that is low transmission within our schools. And I agree with Kristina. I mean, once we hit blended, we can come back, and if it looks like we're never going to get to these numbers, we can do that. But CDC is telling us that this is the low and the lowest for transmission within our schools, and those are those numbers. And what we want doesn't change what transmission rates the CDC finds safe. And I would argue that there are lots and lots of places in the country that are doing this better than we are here in Brown County. And I don't think that's an impossible metric. There will be places that can do that. If we don't get to that level, I would argue that's because of us as a community. There are places that have done this well. Honestly, I saw the list, and we're like the 8th worst place in the world for COVID right now. You know, way to go, Brown County. There are places that have done this. The CDC didn't do this for Brown County. They did it for everybody in the country. And what we want doesn't change the numbers that are safe.
Go ahead, Brenda.
Yeah, I would echo what Dawn just said. And I'm just to put Rhonda's question into context. As of today, when we're at 926, New York City is at 58 per 100,000. So at their, and I'm using different numbers now. I'm using an average daily rate because that's the map that I've been following that goes county by county. But back in April, when New York City was at their peak, they were at a daily rate of 62 per 100,000. We are currently at 77. And so our caseload is higher than what New York City's was at their peak. And yet they've been able to bring theirs down to, you know, their daily now is 4.2, and if you multiply that by 14, it's a total caseload of 58. So I think to piggyback on what Dawn said about, you know, it's the seriousness with which the community at large takes the measures that decrease the spread that really will determine whether we can bring that number down.
All right, I'll call. Go ahead if you want to respond, and then I'll go. I feel like the moderator.
So just so I'm clear, because I will be asked this, I'm sure some of you will as well. When it comes to where we would have to be for a blended model, are we deciding? Because I'm just looking to make sure that I understand. The moderate risk is what was noted, right, in the CDC, then in that category, and that's 20 to 50 cases per 100,000 in a 2-week period. Am I reading that correctly? Right?
Yep.
Yes.
Okay, so we're not obviously voting on this tonight, but we are seriously considering that would be the burden rate for transitioning to blended, just so that I understand.
Yeah, so that's what I would do. I want to try to get the group back together, so I appreciate you doing that. So, Steve, I'll sort of summarize what I've heard and see if you are in the same spot, because I know that your team is going to then bring this back and create the motion. So we've got this CDC model. It sounds like the board wants to place a high level of importance on the burden rate. We feel like we have more accurate data. We feel like that tells us more of what we want to know. I think that having the positive test rate as a reference point does provide some relevant data as to the access of testing, as to what Brenda said, but we're not necessarily want to make our decision off of that number. So CDC model is there. We really want to rely heavily on that burden rate. I think then what we need to transition our conversation to next is sort of those steps. And if we want to operationalize the colors on the CDC model, I think that's what we need to have a discussion on. And if moderate is the hybrid model, is what grade levels does that mean? That's sort of where we need to go next. Steve, do you have any reaction to what I just summarized, or is that where you're seeing us needing to go?
That's when I look at my notes, I think I sense some level of clarity on both ends of the CDC spectrum, focused on burden rate, not percent positivity. And I think the real question is, we're looking at the moderate risk as a clearly category for blended instruction. And I think the question is the higher risk category in and of itself either offsite or blended, or is there some split within the orange higher risk category where some of that's offsite and some of that's blended? That's what my notes are showing right now.
Okay. Go ahead, Brenda.
Yeah, I mean, I was kind of thinking wondering about bumping up the moderate risk into that high risk transmission a little bit. I don't want to go all the way to 200, but I'm wondering, to instead of 20 to less than 50, would we consider 20 to less than 60 or 65 or something like that? And then getting back to the elementary and secondary question too. I don't have I'd be interested in what other board members thought about where that split would occur, or if we're going to bring everybody back to blended with the same gating criteria.
Yeah, one of the things that I want to share when it comes to blended and maybe not when it the different grade levels. Let me try to be articulate here for a second, but I believe that our system is at its highest strength when there is some consistency. So whether everyone is virtual or everyone is in person is when our teachers are going to be able to deliver the highest quality instruction. And while there have been challenges with the virtual model, I think there has been some success and some comfort level for our teachers. One of the things I'm worried about in a hybrid model is creating a dual workload and really making neither model as efficient as it could be. So I don't know if that speaks to your point, Brenda, specifically, but I would be interested if the board wanted to discuss, bringing back some kids back in person before we necessarily go straight to a blended model.
Can I go, Eric?
Yeah.
One of the things I'd also like to explore, and I don't know that actually what I'd like to do is just have a committee look at if we can treat our 4- and 5-year-old kindergarten students differently than elementary and high school. And I know last time or a couple meetings ago, I had suggested maybe bringing our 4 and 5K students back at a higher case burden rate, because I think the data we have shows that the spreadability of kids that young is much less than it is once they hit about the magic age of 10, I think is what the research is pointing to. And so you know, in thinking about it more, rather than bringing just 2 grade levels back, because that's, you know, as far as transportation and all those things, less efficient. It splits up families a little bit more than what they're already split. But maybe having, when we decide we've hit that blended spot, that we bring our 4 and 5-year-old kids back all in 5 days a week. Because I think that, and again, this is kind of what I'd like the committee to sort of research, but it seems like we're not having problems in our daycares, and we didn't last summer, even though the kids are not socially distancing, and the kids weren't wearing masks and things like that. So I just feel, and I feel that because I think that it's so much harder to provide 4 and 5-year-old kindergarten students with good virtual instruction than it is, you know, as we get older. I've observed in a couple of 4-year-old kindergarten classes the last couple of weeks, and it's just there's so much missing that would be a part of their normal day, and I know that there's lots of things missing at all the age groups, but I just feel that that would be worth looking at. And I threw out a couple of different possibilities of what that could look like.
So not something that we need to decide on today, but perhaps something that we ask a committee to look into around
Right.
bringing back our smallest rather than bringing it to hybrid.
Right. Yeah, and I'm not recommending doing, I mean, I think we have time because our numbers are so high. I don't know that I would bring them back today, but anyway, I'd be interested in looking into that further.
Okay, go ahead, Laura.
So Brent, can you just expand on that a little bit? What would that look like, and like who, maybe you haven't thought about it enough to say, but can you just, if you can offer just a little bit more of what you would envision that group looking like, and just to be clear, you're saying you wouldn't want to, let's just say you had this group and you decided that this was worth implementing and the board okayed it. This wouldn't be until that moderate group, that numbers, it wouldn't be like right away.
Right. Yeah. I mean, there has to be gating criteria, and I think logistically, it would make more sense to when we bring elementary back, you know, that's when we would bring 4 and 5-year-olds back, but we wouldn't do them as blended. We would bring them back, you know, every day, all the whole class in the classroom at a time. I think there's and again, we have some of our students are in models like this already in our Model 3 programs, I think. You know, they wash things in between, you know, over the noon hour in between the 4-year-old kindergarten classes, but it's not like what we saw when we went to chapel, where we were in that 4-year-old kindergarten class and the sign said if one person touches the blocks, that's it for the day, nobody else can touch the blocks. I'd like to see us have a discussion about whether we have to be, I don't think we have to be that strict with our 4 and 5-year-olds because of, again, the spreading of that age population. I mean, it seems that even if they test positive for COVID, they're not spreading that to other people, whether in the daycare itself or to their families.
Well, what would this group look like? I mean, just kind of, can you talk about that? Like, have you imagined like what you would think would be effective in a group?
What do you mean? I don't
understand. To explore this.
That would, I think Steve,
that group. Sorry, I thought you were talking about the student group.
Sorry, I don't think I said it very well.
No, I mean, I think it would be teachers, principals, district office. I don't know if there would be parents interested in being part of that group, but that's kind of who I would see as part of that group.
Okay.
I mean, Ann Barsh, Mary McCabe, Andrea probably, and then the selected principals and teachers, 4 and 5-year-old kindergarten teachers.
Okay, thank you.
Go ahead, Andrew.
So I too would be interested in exploring the idea of some different breakouts for for younger age groups. I've looked at the zero. The state of Wisconsin offers a 0 to 9 and a 10 to 19 data point. So although there's babies and some graduates and college students in that, they roughly track the same things, and there is a kind of an exponential trend in the 10 to 19 since September 1st, not in the city of Green Bay. So that pretty clearly indicates that school being open where it was open in other areas of the county did do some of that, because I have a thing broken out by census tracts. Although it doesn't tell you age by census tract, but you get a pretty good. Something happened on September 1st that specifically the 10 to 19 age group started going up, yet the 0 to 9 age group really didn't. Yet the school districts were bringing back, other school districts were bringing kids back. So my only concern is time on this. I know there is value in committee processes sometimes, but I'm very worried about the amount of time it would take, and I don't want to defer our decision. I would like administrative input on the concept of bringing people back earlier, but I really strongly believe we've gone a really long time without setting rules and targets for what will reopen schools blended and what will reopen schools full. I think the public needs to be told, subject to, yes, there could be scientific information that updates it. If a drug is invented that is readily accessible and completely eliminates the virus, then we can be done with this. It doesn't look like that's going to happen, although thank goodness the right medications have seemed to be reducing deaths by 80–90%. So that's good. That's great. I think we need, on October 12th, I think we have to be able to tell the public that barring a big enough scientific breakthrough one way or the other that would force us to reevaluate our decision, that blended education will start blank days after this metric is reached and what the days are that we're checking the metric, and that full return, even if it looks sketchy for this year, full return will happen when 10 days or however many days after we are below this metric. And if there's different things besides just blended starts, if it's blended starts for some, if it's blended starts for all, these are the answers that people want. People want to be able to look at a chart and see what will happen, and it's correct to do it off of cases versus off of a date, although I think some concept of a sunset date to force us to reevaluate because the science is always changing may not be a bad idea, but my original idea of a sunset date was so that metrics wouldn't get, a whole semester old, and so that ship has kind of sailed. I've just been kind of looking through some of the range of counties around the country where you can look at places that have done better than the rest of their states. So I'm looking at California, which is generally doing well. Their worst county would be 400, and their best county, except not counting some tiny ones that don't have any cases, but they're so tiny. California has 4 out of many counties that got below 20, but they're all quite rural. I just don't. I'm worried about us hitting the. I I'm prepared to stand by what I said last week, which was, roughly speaking, that we would start, that we would start everyone back at a 1 week of 4, at 2 consecutive weeks of 40, or since we're now talking 14-day metrics, I believe we could safely have everyone back at 80, and that is not a loose metric compared to many states.
Okay. Rhonda, did you want to go? Yep.
So Andrew and anyone else who would like to chime in, I would like to talk and go back to what Brenda talked about with moderate risk of transmission, the yellow column, the CDC template, of increasing that number into the higher risk. Is that something that people are interested in doing? Because I think that feels like that would help us bring some more criteria conversation in.
Yeah, for me personally, I'm a little uncomfortable. I mean, we to take the CDC guidelines and then just manipulate them to make them more reachable for us doesn't feel like I don't feel real comfortable with that. I mean, we can have conversations, and if it's a small adjustment, I guess I would get behind that. But when I look at highest risk and higher risk, I mean, to me, those are two options where we're 100% off-site. We can talk about the moderate risk as being blended, and then the lower and lowest as being in person. That's what makes sense to me. And if somebody wants to project a small adjustment, I guess I'd be willing to do that. And then, what it feels like to me is there's a lot of different scenarios, and we need feedback. If it's 4K and 5K, or if it's elementary, or what that might be. And so I would wonder if the board would be interested in adopting a K-12 metric that says, just like Andrew said, if after 14 days these numbers are hit, we will start. I'm in favor of that. And then we can always get more lenient and adopt a policy after we get some feedback and some information that says, yep, we would want to bring our 4K and 5K back. But it feels like there's so many different options and metrics that I don't know that we're going to effectively have a conversation that allows us to get there tonight. So I'd be in favor of passing something, getting that motion, voting it on the 12th, and then, as a committee comes back and says, hey, we'd like you to consider this, then we can draft those additions. So that would be my suggestion. Go ahead. Go ahead, Steve, and then we'll go to Laura.
I was just going to say, one of the things that we could do for you is, which I think strikes the opportunity to both use the CDC guidelines but provide some flexibility is, and I've just been doing some drafting here, but we could put together something that rather than specifying the level per se, we could actually specify the burden rate in the motion, which would then allow us to use the CDC as a reference point, but then to Rhonda's earlier question, would leave it open for the board to consider I don't know what the right word is, blending or merging a couple of those categories so that you could have some overlap in there, in particular between the yellow and the orange categories. So you might be able to begin the blended process earlier, whether it's K-12 or, to Brenda's point, if you're looking at 4K and 5. So I just offer that as something that we can do when we start drafting a motion for you.
Okay. Go ahead, Laura. Oh, you're on mute again.
I think we need to get a floor underneath us, and I'm ready to go with the CDC guidelines as they are. If we need to change them slightly, I feel like we can do that. Our numbers are so high right now that isn't a hugely pressing issue right at the moment. As much as people want certainty, we just are not able to provide it. So I wish that we could go ahead and do that now, and then, if we have to circle back and talk about those numbers more. Honestly, do any of us really know what it's going to look like in a couple weeks, or even next week for that matter? So I like I said, I think we need to find the floor, set that, and then work from there.
Go ahead, Andrew, and then we'll go to Noah.
Okay, so I guess I'm interested in knowing, and if it's just that I'm critical of every source that comes out with something, because here's the problem, right? I think Oregon and California have good, reputable public health systems that have picked a very restrictive in California and an extraordinarily restrictive in Oregon metric for returning to schools that was so restrictive they had to update it because some of their small counties, a single case would have put you over the threshold for a whole 2 weeks. So they had to go fix it, right? So, yeah, Harvard Global Health surely is respectable as well, and they allow for some blended to begin at 350, a little high for me, but that's not like Harvard Global Health is a single purpose organization hell-bent on just opening schools for economic purposes or whatever, right? So I guess I'm disappointed that we seem to be moving from a spot where there was some consensus around starting some blended below what we're now calling 200 because it's for 2 weeks, and looking at full normal operations around 80, that starting a little bit at 200 and everything back at 80 has now become, it seems like people are talking about 50 and 20. That's an enormous change, and it's a change from attainable gradual progress to barely attainable, and with regards to a full return, I'm going to say just, if there's a word that is just barely above unattainable, that would be the word that I'm looking for. I also want to do this soon because we can, just as we can spike up quickly, we can drop down quickly. And we have had an almost 90% drop in a 20-day period in May. We did do that. And that's why I don't want there to be a lot hanging out there on October 12th. If I will certainly have to vote no if 50 is required to even start blended. I mean, I think it's too far to go. We're balancing, and I am, just in case anyone doesn't know, I am not a COVID denier. I wear a mask. I've changed what I do a lot. I'm trying to balance two real problems, and one of them is COVID, and one of them is the real problems of kids not being in school. I just have to share, because I wanted to make sure I shared this in public. I did have someone tell me, although, Brenda, I do think that starting gradually with younger ages is good. I did hear from someone in the community the highest of praises for the kindergarten, that she was very worried about the year her kid was going to have, and though she fully gets that in-person is better, was absolutely thrilled with how they were doing it at Langlade in every way, shape, and form. So I was happy to hear that, and still want that kiddo back in school. probably, and I think it's probably safe to do that a bit before Noah can go back in school, but a bit. That's why I think it should be graduated.
Okay. Noah, did you have? Yeah, I couldn't remember. I'm sorry. Go ahead.
You're good. I'm probably more confused than you are tonight. Thank you, Mr. President. Okay, I have one question and then brief rant, and then I'll shut up. So, as far as the paper I have in front of me, this chart, is this meant to be like to tell you when to do certain from what your explanation was earlier, is that this is kind of like when the state sent out something, although slightly improved, where it's not telling you open school at this time, go to this kind of model at this time. It's just giving you some colors so you got something to work with. Is that accurate?
That's correct.
I'd actually say if you read into the longer document, they'll tell you that when quoting, you should be considering alternative learning models at this level, and then further on in the document, they'll talk to you about this should be a hybrid learning model. This should be full-sized in-person classes. So at least the one thing that gave me some level of cautious optimism with this, there's far more direction given to schools in this document than anything else we've seen so far.
Okay, thank you. I actually do appreciate that. I think it is valuable. All right, here I go. So there are some problems with this. One is that by nature, the CDC is a federal organization, right? So I don't think it's going to fairly represent everywhere. Two, our numbers, yes, are extremely high right now. So it was pointed out correctly. I agree with you, Laura, when you said that no matter what we decide for numbers right now, it's gonna be a little while. I get that. Here's the problem, though. People are getting antsy, and I get that you might have to revise something, or maybe some new scientific breakthrough will come up. People need to see something. They just need something, and this is gonna get voted on hopefully on the 12th. I'm hopeful you guys will go through with that and not move it again. But like, no one knows what's going on, and I get you guys don't really either. Nobody does. I get that. But as the leaders of the district, people are kind of looking for a little something somewhere. So I don't, as far as how much weight I give the CDC, I give it just about as much weight in the modern climate as I do a lot of the other expert opinions coming out from private universities. And those range so far as to say that what the CDC put out could either be really good or really bad. You know, it depends on which expert you are looking at. So it's not that I don't trust the experts, and I'm not trying to bend the experts to do what I want. I'm trying to actually find out what the experts want to do. And the problem is that depends on which expert you ask. So I don't really think this is worth too much more than anything that either Harvard or Oregon put out, except for the fact that it provides the direct guidance. And I think that can be used and amended to meet our district. I'm glad to hear they specify some things. I like the idea brought of how can we get younger, like the very young kids back, because they really don't spread it very well. That's a fair point. I don't know what that looks like. That is so far above my pay grade. I'm not even going to say anything about it, but it's a good idea. That's it. In short, I think what we need is a vote soon. I hope on the 12th you guys can come up with a vote with realistic numbers. I don't think this chart in front of me is realistic at all. I think it's completely unrealistic to expect any of these numbers to get reached soon. And what I think would help get people to start taking it seriously, students included, is if they can say, here's your number, get to it. So stop messing around, just don't spread the virus, and we can actually get to these numbers. Because right now what people have told me is, okay, there's nothing in front of me. They're not going to open school no matter what. I am going to be virtual the rest of the year, so what's the advantage to me? I don't care. And I don't agree with that mindset, but it's out there, right? I mean, it is what it is. So if people are walking around and having parties and stuff without masks because they don't care, right? You know what I'm saying though? I think I have a point in here somewhere, even if I'm not coherent, that we need to get something written down somewhere. Because then what students can say is they can look at this and say, or a news station can put out, eventually when this number gets hit, we can start moving in a direction. I think what comes back on the 12th, unfortunately for you guys, I will be there as well. have fun with that. But I hope that there is something a little bit more direct and that says when we hit this number, this happens, instead of kind of a loose thing like we're in now. In short, get something on paper, get it solid, and if you need to amend it, amend it. But I think we just need something written down, and it needs to be realistic. Thank you, Mr. President.
All right, Steve. So try to put a bow on it. Go ahead, Rhonda. Yep, Rhonda, go ahead.
Thank you. I want to raise the point. I want to go on record stating that although I agree with what Brenda's saying about 4K, 5K, we've had emails. We know there are some things we do know, right? We may not have certainty, but there are things that we do know that are happening in our community. There are a lot of social, emotional, mental health issues with kids in 6th through 12th grade happening. I believe as a result of not being able to be in school. I believe that. So when we consider moving forward to a hybrid model, I hope we seriously consider moving everyone and not just the lower grades. And as soon as we can get kids into schools with the numbers that we decide for hybrid, I hope that we are truly looking at everyone. I'm also wondering about, because it was mentioned before we took a vote in August about the plan, there was a survey that was out there asking families what would they be interested in doing? Would they be interested in just doing virtual? And unless we know the numbers of families that we're looking at, because there could conceivably be a lot of people who wouldn't, doesn't matter what numbers we're at this year, they are not interested in going in person. I think until we know that number, at least have a ballpark of that, we don't really know what we're looking at. We could be in a district of 21,000 students looking at 15,000 students to move into hybrid. I think it's important to do that. I mentioned it before, but I just wanted to throw it out there again, that I'm hoping that we can take some time to ask our families, would you even be interested in coming in? So that we know who we're working with, what we're planning for, the numbers of students that may or may not even be part of the equation. I'm hoping that that is something that's also going to be seriously considered. But to reiterate, there are things that we know, right? There are things that we know aren't working. We're hearing from people every day. We're getting emailed every day from families. And to have something out there that shows that we are committed, we're not promising people certainty. We're promising that we are working towards something. And I'm hoping that we can do that very soon and hopefully by the 12th. Thank you.
Well, Steve, if I were in your shoes, I don't know that I would have a clearer picture today than I did before that conversation started. I'm hoping that you can discern kind of where everybody's at. And at the end of the day, a motion is going to come forward on the 12th, and the board can either vote it up or vote it down. If it votes it down, then we would go back to the drawing board. Go ahead, Andrew.
Yeah, I just want to say, and this isn't good, this isn't bad, it's just reality. Having talked about this at length with board members over weeks and having listened to the community and everything, but mostly board members, there probably is not a return metrics package that all 7 of us could vote yes and mean it. There just isn't, because I believe probably there's a point where I would feel it was too restrictive and have to vote no, that others would not be able to vote yes. And I respect the fact that individuals have done their own research and looked at their own models, and I've talked with most of you at one point or another in principle about different, different states where they may be doing it well, where they may be not doing it well. And I was just looking at Arizona, and they had something I kind of liked, and then it turns out most districts are doing their own thing. So they're probably, I guess I would say to Steve, if you're, I probably wouldn't spend too many extra hours trying to find the one that passes 7-0, because I don't think it can, because of sincere differences of opinion where people draw the very difficult line of where to balance COVID safety, which is extremely important, and returning to school, which is extremely important. But I hope to find some middle ground that we can get to.
Yeah. That's a really good point, Andrew. And, if you think the 7 of us are elected to represent this community, I mean, it makes sense that we're not all in the same spot on a topic that clearly has a lot of different opinions. So that sort of makes sense. And at the end of the day, we're all going to have to take a vote. And if it doesn't pass 7-0, that's okay. So, Steve, unless you need something else on this topic, do you just want to discuss quickly the data source? I know Andrew talked about it just a little bit, but maybe you can just give us a quick overview of what you've learned about the difference between DHS and Brown County.
I can tell you that if the focus is on the burden rate, which I'm very comfortable with, I know we'd somewhat settled on that before the CDC released their guidance, then I'd have to echo Andrew's concerns that the Brown County data set, unfortunately, does not include the Oneida Nation. The children and the families of the Oneida Nation are part of our family as a district. And I think to Andrew's point earlier, I think it's important that we ensure that their data set is included in our decision-making process. So given that, I would recommend that we consider using that DHS burden data as our data point when we go ahead and work on drafting a motion for you.
Yeah, I mean, I would just echo, I'm not interested in using any data that doesn't include all of the students in our district, and certainly that includes our native students. So, does anybody feel differently about that? Go ahead, Rhonda.
Did they say why they're not including Oneida Nation?
They indicated that the Oneida Nation had asked them not to include that data in their data set.
So this was something that Oneida Nation requested?
That's my understanding.
Okay.
Okay, well, absent anything else on that, it sounds like we'll use the DHS burden rate. Okay, Steve, does that give you everything that you need?
I think it does. I think we've got enough information in terms of what components in the CDC model are appropriate. I like Andrew's terminology in terms of setting some spaces in there where the board will be able to say after a certain period of time, we'll begin that transition process. I think I heard quite a bit about both polar ends of the model itself and some of the consternation that exists inside the model. I think I've got enough information and notes here that we can work to draft a motion that will have enough flexibility in it that if it needs to be changed at the table, you'll have clear indicators of where to do so, and then hopefully give you an opportunity to take action at the end of the evening on Monday, or on, not next Monday, Monday after that. 12.
Perfect. All right, absent any other comments, I'd look for a motion to adjourn.
So moved.
Second.
Beth?
McCoy,
Aye.
Shelton,
Aye.
Becker,
Aye.
Smith,
Aye.
Sitnikau,
Aye.
Warren,
Aye.
Vanden Heuvel.
Aye. All right, past 7-0, work session is adjourned.
Thank you.
You have been watching the Green Bay Area Public School District's Board of Education meeting. Please visit the school district's website, www.gbaps.org, to view the program again. If you cannot fully access the information on this video, please let us know the accessibility issue you are having by calling 920-448-2025 or by email at communications@gbaps.org. We will try to provide the information to you in an alternative format and/or make the necessary improvements to make the information accessible.